and then we'll be jumping into the thematic group discussions. Let me take you to the agenda next. Fantastic. So this is what we have planned for the hour. We know many of you are in many other Zoom calls throughout the day. So although we have a lot to discuss, we thought it's a packed agenda, but the way this is our proposed way of handling the call today. I will be doing a brief overview, and then we will be going into breakout groups. And then I will explain how those breakout groups will function. We have 5 thematic themes. Gender and COVID is a very expansive agenda, and there are specialist communities, and we wanted to speak to those different constituencies. And therefore, at this stage, we broke up the endeavor into these thematic groups to have further depth into the initiative. So we'll be spending half an hour in these thematic groups where there'll be brief presentations of the work to date, some of the emerging priorities, but also a discussion. We have an incredible lineup of discussants who will be sharing their experience and their perspective informally of what they see emerging and what are next steps. There'll be an opportunity to ask questions and provide inputs, and then we'll be coming back into plenary. We're extremely excited to have Dr. Ana Maria Henao Restrepo from WHO Geneva, from the COVID-19 Research Roadmap, to be also speaking with us on how we link up with that initiative and what are the opportunities together. And then we'll close out. Pascal Elotti, the director of IIGH, will have some concluding remarks based on what Ana Maria shares. And then Arinjay will just have a brief update on how to stay in touch. Can we go to the next slide? So it would be great if we have 98 participants. If in the chat room, just introduce yourselves so that we get a sense, 99 of who's in the room. And please keep yourself on mute to avoid background noise. I think speakers, we have people from all over the world. So I'm going to ask, unless you're speaking, perhaps keep your video on off to improve the bandwidth connection to those areas of the world that have limited bandwidth. You're welcome to put in questions in the question and answer function toolbox, and we'll be monitoring that. And if ideally, you should see at the bottom of your screen, the breakout rooms, which we will move into after this introductory presentation. At the end of that half hour, we'll come back into plenary. If you can't, if you don't have an updated Zoom version, not to worry. Vidya is there in the background, and she can allocate you to a breakout room in case you don't have an updated Zoom connection. So great to see the introductions rolling. Let me keep going. We have a formal introduction of some of the those of us who are speaking. Next slide, please. So we have, as I mentioned, through a collaborative process, we decided on 5 thematic areas. We felt very strongly since, as I said, gender and COVID is such an expansive set of topics and issues. So we worked through getting input through the discussion board and through a Google Doc and through a webinar on shaping these 5 thematic areas. So we're delighted to have Claudia Abreu Lopez from IIGH facilitating the discussion with Thematic Group 1 on health status and behavior. Professor Geeta Mishra from the University of Queensland will be presenting. She's part of that group very briefly on some of the initial findings. And then we have Dr. Tina Purnat, who is part of the European CDC, but joining WHO. She's an expert on infodemiology, infodemics, and I remember from the roadmap convening that she had one of the most exciting presentations. So it'll be a terrific discussion, I'm sure. For Thematic Group 2, we have our very own Dr. Lavanya Vijaysingham from UNU facilitating that group, and really excited to have Dr. Jeanette Wolfe from the University of Massachusetts Medical School Bay State here with us. She has some amazing initiatives reaching out to the medical community, bringing them up to speed on sex and gender, including games they can play so they get oriented on sex and gender. So we're really delighted she's there. And Shireen Haidari, who is part of Gendro, but is speaking because she co-authored a paper on gender, sex and gender in this area. And we're delighted to have her here as part of the discussion. For Thematic Group 3, we have our very own Pascal Elodi, the director of UNU, and we have Dr. Sedi Hosseini Jebeli from the Iran University of Medical Science presenting the emerging findings. We had hoped to have Jeanette Vega, who Dr. Vega was in touch with me up until last night. This is the reality of our work. She is down with some symptoms and therefore is not well enough to join the webinar. I think in the year we've been working together, so many people have been directly affected by COVID and has caused so many uncertainties. But we will, there will be other ways in which she can contribute to the agenda. Mamatena Motupi will be from UWC will be presenting some initial findings from the paper in her place. Next slide, please. And I'm going to keep an eye. I have to speed up so that we have time for the breakout groups. For Group 4, we have Michelle Remy from UNU facilitating the group on social determinants of health. Atria Mir, who has been part of that group, who's a specialist in gender diversity and working in humanitarian settings as well. And then Professor Mark Tomlinson from Stellenbosch, also here from Cape Town, who has an esteemed research trajectory, but is also working with the SBRI Research Prioritization Initiative. I will be in Group 5, and I'm delighted that Mbato Motsamai, who's a colleague of ours, will be presenting, and that we have Agnes Suka on the line. She's a tremendous experience in health financing, but also was in charge of health financing and governance at WHO Geneva, and is currently at the French Development Agency. So that's the lineup today, apart from all the introductions in the chat function. Let's keep going. We have, just to briefly say, what is our overall aim? I won't spend too much time on this. We felt very strongly, this started a year ago, and we felt very strongly that there were many calls for advocacy, many calls for research on gender, sex and gender in COVID-19, but very limited actual evidence. And the work by Sarah Hawkes' team at Gender 1550 has highlighted the limitations in data sets as well, that we don't have enough information. So we wanted a way in which we could systematically set research priorities and do so in an open way, that it includes researchers, of course, but also other stakeholders, civil society members, donors, and to do it in a truly global way. And I think as much as COVID-19 has brought its challenges, having an online way to open up these discussions is really critical, so that it's not 50 people in a room in London or Geneva setting these priorities. This is done in consultation with many other groups, and we're looking forward to continue those conversations. So it's not a standalone initiative. It is something we've had a couple of meetings already with other groups, and we look forward to engage with all those that are in this space setting priorities. Next slide. So just a shout out, it's not just me alone. I've introduced others in the team, but I'm really delighted to be able to work collaboratively with so many across the globe that are contributing in different ways to shaping this research agenda. Should we keep going, Narinjay? This is a slide some of you might have seen on social media. Given time, I won't spend too much time on it, but just to say we started last August. It's a 1-year anniversary since we kicked off stakeholder engagement. We had in the first few months over 400 people join from largely LMIC settings, and that's still a strong feature of our work. We've developed the research protocol in an open way and then had online discussions as the drafts developed. And we are now in the middle of getting responses for the thematic surveys. And we will have a way of bringing this to a close. I'm going to keep going because we're going to revisit this at the end because I know we're short for time. So a sense, we have already 111 responses, which is really exciting. So although we've engaged with people in many ways, we still need to get them to spend time responding to the surveys. We are just releasing the French survey and we'll be translating into Portuguese and Spanish. And my sense is that will really strengthen further engagement with West and Central Africa, with Francophone Africa, and with the Americas. Next slide, please. What's delightful is the LMIC contributions have continued. I just want to pause here, and this was a sense to explain, we have 101 responses, but the comfort zone of those working in gender and health is in the social determinants of health. And that's why we have, most people have responded to that group. The focus of our Generation Equality Forum session that we had earlier was on highlighting the importance of therapeutics and diagnostics, health service delivery, and governance as core parts of a research agenda that addresses sex and gender in COVID-19. So we're hoping to get further engagement in those thematic groups. This is a brief explanation of the criteria when you see the results. We simplified, participants had to score based on whether they thought each research question, the likelihood of the potential health benefit in answering that research question, and whether it improved gender equality, empowerment of girls and women. And the impact score combines those two impacts. And then separately, we listed urgency. How urgent is this research question? Next slide. I think we have, this is the interactive dashboard where you can log on. Claudia Lopez was integral to this work. It's exciting that this will be updated once a week. And you will see how the results change. We're going to publish an FAQ that makes it easier to navigate, and we'll do a follow-up webinar and ways to explain how best to navigate the site. But it's so exciting that anyone can look at the results as they're emerging. I'm really proud of this. Next slide. So I think we'll come back to this, so I'll just to say that, as I said, we will continue. We're midway through the surveys, and we are hoping to close this process out at the end of September, the thematic surveys, and then move to overall prioritization. But I am eager for us to move into the breakout groups. Time is ticking. So I know that was a very quick overview, but it's amazing to have 113 of you here And I'd like to invite you to the breakout groups because we have so many amazing people on the line and to join those discussions. So if you go to the bottom right side on your screen, you should see the icon for the breakout rooms and then be able to go into one of the breakout rooms. Thank you very much.
Hi, everybody else in the main room. Have you not been able to join the breakout rooms?
No, please
I didn't get
add
the
me
prompt.
3.
Okay,
Yeah.
don't worry. I'll just get the facilitators, discussants, and presenters in first.
That'd be great.
Study TG3, right? Study TG3. TG2. Just a second. This is super manual. Tina.
Number 1.
TG1. Thanks. Okay. Shireen, TG2.
Great, thanks.
Dr. Ana Maria, which group would you like to join?
I am working on something else, so if I don't join, is that okay?
Yes, not a problem at all.
Okay, thank you.
Okay, now let's go to, as I call out your name, just let me know which group you would like to join. Akio Nonogaki. We have health status and behavior, therapeutics and diagnostics, health service delivery, social determinants, and governance. Radhika, I see you there. I'm going to make you co-host.
Great, thanks, Vidya.
And TG1, and then you can just hop on. Arinji,
Yeah, hi Vidya.
where would you like to go?
I'll stay here for now in case
Okay.
you need any help.
Okay, thank you. Dorothy Onoja? Dorothy Onoja?
Yes.
Do you have a specific group you would like to join?
Anywhere, government, anyone you like.
Okay, anybody here who already know which group you would like to join? Just let me know.
Hi, Vistia. This is Michelle de Jong. Could you put me in group 4, please?
Sure.
Thank you.
And nice to see you here, Michelle.
Yes, you too.
Hi, I actually got disconnected, so I'm not sure which groups are available. It's Ernisha, and the chat unfortunately went away when I got disconnected.
That's okay. Arinjay, could you just put the number and the name of the groups there?
Thank you.
Michelle wanted group TG5, right, Arinjay?
Yeah, I already sent her. I can also assign, so as in when people are saying, I'm just sending
It's
them in.
in 4. Michelle is in 4.
Yes.
Okay, I thought she wanted 5. Sivan Saraswati, social determinants of health. Sure. Coming up. Thank you. Fidelis, are you okay? I see that you've not been able to join. Dorothy? Anything is interesting here? Ranjini? Okay, I'm also assigning people randomly that I've not heard back from.
I'd like to go to group 3, health service delivery,
Sure.
or group 5, either 3 or 5. Thanks.
Anjay, you got that one?
Yeah.
Okay, I don't want to double.
Sorry, this is a bit strange. I can't seem to find you, Ernesha, in my document.
Yeah, me too, actually.
I can find everyone else.
You don't see me on the, I don't know, that's weird. I don't know how to, if it's something I'm doing or should do or don't do, or.
Oh,
I got
okay,
a little pop-up message. Are you able to send me a invite?
Yes,
or-
yes, I can send that to you again. Sorry, can you just say again, which TG did you want to go into?
Oh, let me just go to 3, health service delivery.
3. Sure, you
Thank
should get
you.
an invite now.
Got it. Thank you.
Perfect.
So everybody else, I don't think they're at their desk because I've assigned them already, but they've not accepted. Sorry, Anjay, it's just me and you.
Yes. Is there any TG you'd like me to go into just to sort of look around, or should I?
No, it'll be super helpful to get you to share screens because my PowerPoint is not working.
Sure, no worries.
I have in the SharePoint. I think it's on the SharePoint. SharePoint, no. Let me upload it in SharePoint. So I'm uploading in that SharePoint the intro, breakout room, and closing slide. If we can share the breakout room one that says
There, I think people are starting to join the breakout rooms now. Sorry, Vidya, did you also have a slide on ways to connect?
no, I don't, because it's registration. We want people to register. But the YouTube link is on Twitter and all.
No, I was saying ways to connect in the future with our project.
Yes, that's third slide then. Third or fourth slide. That connect to this call. So we have someone from the International Working Group. Oh, okay. Hi, Peace. Welcome. We have all moved to the breakout room. Would you be interested? Would you like to join one of the 5 groups we have? I'm just sending it on chat here so you could choose. Are you there, please? Okay.
Yes, peace is there.
Hi, Peace. Is there
Thank you.
nice to have you. Is there a specific group that you'd like to join? So I've just put it on chat. The first group we have health status and behavior. Second is diagnostics. Third is health service delivery. Fourth, social determinants of health. And fifth, health governance.
Fourth.
Okay. Hi, Professor Vivian. Nice to have you here. How are you? Professor Vivian, are you there?
I don't seem to be able to turn on my camera. It
Oh,
says
no.
cannot start video.
Oh, no. Let me just say, ask to start video. Let's see if that works.
Nothing seems to be working. Video settings. Let's see if I can do something else. Video setting.
Hey, hi, Dorothy. Welcome back. Dorothy, welcome back. Do you have a specific group you'd like to join? Professor Vivian, we have 5 groups.
I'm happy to join the governance group.
Perfect.
But I can't turn on my video. I'll have to bring my laptop into work tomorrow and get it fixed or something.
Either way, happy to have you here.
Sorry, I'm late. I just got home.
Don't worry about it. Thank you for joining. Hi, Kevin. Welcome. Scared me a bit there. Okay, RNJ, it's just me and you. And Dorothy. Oh. Can you put on the slide, RNJ? The folding screen.
Sure, which one exactly?
I've sent it to the SharePoint link. And if you see as a file that's labeled 1 intro breakout room closing. And it's that slide, and I think that slide deck, but the third slide, I think.
Okay, the one on the Google Drive.
Yes. Everyone watching on YouTube, we are in the breakout rooms. The meeting is currently in the breakout rooms. And I'm very sorry you won't be able to see the streaming there, but we will make sure that the videos are available. And we will be back in a few minutes. Not that one, RNJ. Not this slide. Can you show me the SharePoint link? Hi. Hi, Echo, welcome.
Thank you.
We are all in the breakout rooms right now. Do you have a specific room that you'd like to join? I've just put the names of the groups in chat.
Okay. Yeah, I was already in health service delivery.
Oh, no.
But I was locked out due to network problems.
Not a problem. I'll send you back to service delivery, yeah?
Yes, please.
Okay. Nasreen, hi, welcome.
Thank you.
Sorry, Nasreen, I can't hear you. I think the line is bad. Could you perhaps put in chat which group you'd like to join? Do you have the link, the names of the group? Rachel, Sadi.
Please add me to TG3. I was disconnected.
No problem. Nasreen, Linda. Linda, you were here earlier. Okay, Nasreen, adding you to health governance. Arinjay, how are we going on the slides?
I just sent you the drive link that I've got. Please let me know if it's a different one to that.
I've just sent you back.
Oh, right, I see. Okay, okay.
Rachel, hi. Professor Vivian, governance. Hi. Can see you now. So back to governance, is that okay? Yes, perfect, Arinjay, that's the one. Hi, Horea. Welcome. The groups are currently in breakout sessions. Do you have a specific group that you'd like to join? Thanks, RNG. Hi, Doris. Hi, Doris, welcome. Is there a specific group that you'd like to join? Everybody is currently in a breakout room. Hi, Doris, welcome. Is there a specific group that you'd like to join? You're muted.
Okay.
Hi. Is there a specific group that you'd like to join?
I like to join a little bit, yes.
And would you like health status, behavior, therapeutics and diagnosis, health service delivery, social determinants?
I believe the first, the room one.
Okay. Enjoy.
Okay, bye.
Lavanya, could you please just let me know if the slide that I'm sharing right now, if I change my window, can you still see that slide, or is it now changed?
No, I still see the presentation.
Okay,
Right.
perfect.
Hello, hi Dudu, welcome. Can you hear me? Dudu, if you're speaking, I can't hear you. You're probably on mute. Hi, Catherine, welcome. The other participants are all currently in breakout rooms. Is there a specific room that you'd like to join?
The health status and behavior room, if that's acceptable.
Of course.
Thanks, I just got out of class.
Not a problem, enjoy.
Thank you.
Hi, Fatma and Elsa, sorry. Everybody, the attendees are currently in breakout rooms. Is there a specific room that you'd like to join, Elsa? Hi, Fatma, welcome. Is there a specific breakout room you'd like to join? Hi, Namrata, welcome. All the other participants are currently in breakout rooms. Is there a specific room that you'd like to join? Arinja, your cursor is just phantomly moving everywhere.
Sorry, I think something went wrong with my computer. Just gonna restart the sharing.
Can you have the slides up, Arinja? Okay, great. Hi, Ulrika. Hi, Ulrika. It's nice to see you. How are you doing? Oh, no, you're muted. So everybody.
I was muted. I'm doing well, thank you.
I'm glad. I'm glad. So everybody currently in the breakout rooms, although they're already going to come out soon.
Yeah, I was in a breakout room, but I was through now because my internet went down. No, it was me.
Oh, no.
So I will just hang around here with you then and wait until they come back.
So there are 30 seconds left. Would you like to go back to the room or?
No, I stay here with you then.
Okay, sure.
How are you?
I'm good. It's so nice to see you.
Yeah, good to see you.
Yes, it's evening.
Has it been busy?
Oh yes, but the good kind of busy, very productive busy.
Yeah.
Yes, so it's keeping us all rejuvenated in a sense.
Ah, that's cool.
I'm glad. I was worried that you would have missed the meeting, but I'm glad that you joined earlier.
Oh no, I was in the meeting room number 5 on the governance.
Okay.
Yeah. So I was thrown. If it's possible, I would like to see the slides afterward.
Yes.
To catch up.
Sure.
Okay.
We will send the slides. We will send the slides and the recording as well.
Okay. Thank you.
Welcome.
So I will mute myself now
Okay, sure.
because they will be
Welcome
back soon.
everyone.
Sure.
Yes, I think we have 22 people back, but we had almost 100 people before we went into breakout rooms. So welcome back from the breakout rooms. There's never enough time to discuss all the issues. We had a brilliant, I was in the thematic group on governance, and Agnes Suka shared some brilliant observations, giving us a sense of the background on governance, but also how it's linked to individual empowerment, the ties between working at the individual level and how governance is about collective action. It was a really engaging commentary. I'm seeing, I think we're all just coming back. We'll just have a moment as people come back, because I know we had about 80 to 100 people at the beginning. So my sense is they're still coming back from breakout groups. And
Just
we will be-
20 seconds
yeah.
more till the rooms close, Asha. So everybody should be back.
Okay, I can see people popping up more and more. So we'll just wait a few seconds for people to come back into the plenary group. And then we're very excited to I hope you had good discussions. I can see it's jumping to 94, 95. It's wonderful to have so many of you here. As I said earlier, we're halfway through the thematic survey, so it would be many of you responded, but I hope this webinar sparks interest in contributing to the agenda. I believe everyone is back. I hope you had very interesting and fruitful discussions, sharing observations, getting a sense of the flavor of what each thematic group is about. And let me introduce Dr. Ana Maria Henao Restrepo. We are very excited to have her here speaking on behalf of the WHO COVID-19 roadmap group. Ana Maria, are you, I just saw you on the screen. Yes.
Yes, can you hear me?
Yes, thank you so much for joining us.
Okay, so I have a few slides. Let's see if I can share them. Okay, I am not able to share my slides.
Just 1 second, Dr. Ana Maria. I'll get that fixed. Okay, you should be able to share now.
Okay, can you see my slides?
Yes. Not the full version though, just yet.
No?
Perfect, thank you.
Okay, so I have a disclaimer to make. I am not an activist of gender issues. No, I am a woman, so that counts. And I am from a developing country, so I get 2 brownie points, but I am not an activist. So I am going to talk about what we are doing on research and development to promote fair and equitable access to vaccines, therapeutics and diagnostics, and other research in WHO. The first thing I want to say is that we work end to end, so we are not getting engaged and promoting research that just finds the results without taking into consideration the access. So I work in a team, and I am the co-lead of a team called the Research and Development Blueprint. That is a WHO-wide team that have the vision and the mission that is written here. And we work for emerging epidemic diseases. This is why we are working on COVID. When we have meetings, we are very lucky that we have a great audience, and we think the first way to get gender equity is to get equity, full stop, and to have democratic knowledge accessible to everybody. So this is from our forum in May. We have 29,000 people from all the countries all around the world, except a couple of countries in Central Africa, participating. And for that, that's the most important thing. And in all our consultations, including the one we are having on September the 3rd, we have always more than 2,000 people registered, and very often between 5,000 and 10,000. So that's one thing that is very valuable and important for us. The second thing is that we have clear goals for this pandemic, that is the acceleration of the innovation and the research, but also for the future, that it means that we are preparing the global research platforms, global ways in which people can collaborate, researchers all over the world can collaborate in what people say is the global south. I call it my towns, okay? So then, what is going on? Yes. This slide is to show you the extent of our efforts of collaboration and the acknowledgement and the thanks we give to all these thousands of researchers from all around the world that have joined us from the beginning of the pandemic. So I am not exaggerating. We have more than 3,000 researchers, not that click to one of our meetings, but that are members of committees, deliberations, meetings, that participated in reviews of documents, etc. And we have more than 1,000 institutions that also do the same, that collaborate with us, that participate. That's very important. Beyond COVID, we are working in a number of priority diseases, and here in green is the ones for which we have done what we think is important to prepare for research, to have a clear roadmap of what is known, what is missing, to have target product profiles, TPPs for the vaccines, the therapeutics, and the diagnostics, to have a regulatory framework that could accompany this work, and also to work on protocols so that whatever the research is done is of the highest quality and has an intention and the possibility to generate robust estimates, not only boutique studies. This is what happens in COVID. As you know, thousands of trials were initiated all around the world for therapeutics. But that's the positive thing, that lots of people start randomizing drugs and therapeutics all around the world. The sad part of it and the problem with compartmentalization, with nationalism, with everybody trying to be the first ones, is that we have thousands of trials who have not contributed to any global policy discussions or local discussions because they were too tiny, because they were never completed after they started. So, and only a handful of trials have really provided information that we can act on. So the first thing is not to segment the field, but to actually contribute to the mainstream discussion. By transforming the mainstream discussion, you can achieve more than segmenting the field. I read in your documents that the gender is not reported, so I wanted to give examples that you are unfortunately or luckily not correct, that all the trials are now reporting gender. And I took a special pride because our WHO Solidarity trial actually reports on gender and gender outcomes in the report that is available in the internet in the New England Journal of Medicine, and we intend to do the same for the final. But I use the other large platform trial that you know have contributed with results, the recovery trial, and I check, and they also report on gender. So yes, it's true that everybody reports on gender outcomes, but this is changing, so you should congratulate yourself because the things have moved on. Now, on the trial designs for vaccines, there are many trials ongoing, several of them in phase 3. There are, you know that we have a lot of vaccines that now have been receiving emergency use. One has received full authorization, but the sad part, and in WHO, we are tired of discussing inequity in access. Our Director General has talked about it. There is no way in which inequity could be talked about in a diplomatic way, as Dr. Tedros says. There is no diplomatic way to talk about it. So this is why we continue to push forward with more candidate vaccines being evaluated, with more candidate vaccines coming into the race. Because if we don't do that, if we stay with the ones we have, it will be very difficult to transform the status quo. You also know that WHO is working on all fronts, improving the policy, expanding the capacity to produce, debating intellectual property, etc. But having new horses in the race is as equally important as all these other strategies we are taking care of in WHO. Then, what is happening? Then there is the emerging issue of the variants. This is critical, and I just want to spend 1 minute to tell you that we are working on this, that we have created a committee, that we are developing the tools and providing on our website systematic analysis of all the variants of concern and their distribution, but also of the effects or lack of the effects that they're having on different vaccines and therapeutics that are being used.
This boy, I'll continue tomorrow.
Excuse me? So I continue. So on trials, the voice we want to give to you is that platform trials, large trials with the governments and the member states and the researchers from the South at the center of this trial is the way forward, and we want to promote that. That's the best way to promote opportunities for boys and girls, young researchers, male or female, to participate, to engage in the research. The second thing that we want to promote is that when you do research, you have to have a fair and equitable access in mind. That if you are discussing including a drug in your trial, in your research, scaling up of manufacturing, issues related to intellectual property, technology transfer, capacity to produce and access, fair and equitable access should be prioritized. This is what we do in WHO whenever we include any drug or any vaccine in our trials, and we are encouraging all our partners to do the same. Coordination is really important. Thank you for inviting us. This tells me that I have to repeat what we always say. We are not building capacity. We are providing access to opportunities to researchers, male and female, all around the world. That we should not have a patronizing approach of building capacity like if there is nothing there. We are giving access to opportunities, and as a woman from the global side, I am personally very passionate about that. So together we have a roadmap. You can visit this in our website. It was published in our website. And I want to finish by saying that since I am not the activist of gender, I just want to say WHO has been working on gender and inequality regarding COVID and COVID vaccines. We have insisted that we have to put gender equity at the forefront. The women are at the center of the response and constitute the majority of the healthcare workers, and it's important for them to be protected and respected, and that as long as the virus circulates anywhere among women and men, nobody is protected. So finally, WHO has a wonderful, funky website, and I want you to visit it where you can engage in all kinds of documents related to gender issues and what we are doing in COVID and beyond. Thank you.
Thank you very much. Asha, are you happy for me to pick up here?
Yes, thank you so much, Ana Maria. Over to Pascal. I know we're out of time, so thank you, Pascal, for closing us out, and thank you for sharing those words, Ana Maria. We look forward to working with you.
And I'd like to say thank you again, and I do want to acknowledge and possibly take, for all of us to take some credit for the reporting now, or increased reporting now, of sex disaggregated data, and we hope there will be lots more of it. I think a lot of the reason that this process was started was partly advocacy, but really partly incredibly passionate about making sure that there is a diversity of voices that comes to the table. And I think one of the really nice things that has come out of the COVID effort is just seeing how much researchers have rallied together. Your presentation shows amazingly, and just the response that you get from this R&D blueprint work is a really nice example of how it is we put aside our rivalries and competition, and really rallied together for mankind, for people kind, towards the COVID effort. And this is exactly what we're trying to do with this project as well, which has provided an opportunity for civil society organizations, for policymakers, for researchers, for a whole range of both feminist groups and those who don't necessarily think of themselves as feminists, but as just researchers, to really come together and just listening to the presentations as well, it's really valuable seeing how all of us can now push back in those meetings that say, well, gender is not important, it's just about the COVID effort, because it's very clear from the questions that have been prioritized that there are in fact concerns from consumers, from patients, from researchers, from health workers and so on that do relate to gender that are not quite being captured in those high level research agendas that are part of the R&D blueprint. So now that we have you, we are going to keep you, and we're going to keep knocking on your door to make sure that as we bring we open up the spaces for people to engage in what the priorities are for them, that there is a space in the larger R&D blueprint work to make sure that some of these concerns are heard. I will hand back to Asha and to R&J, I think, to talk about what the next steps are and how we can continue to engage with you. Thank you.
Thank you so much. So as R&J puts up the slide, we have, we're releasing the different translations. The French translation is ready to go. We're hoping to have Spanish and Portuguese come online this week or early next week. So it would be fantastic to ensure there are diverse voices contributing to the agenda. And then we'll circle back to you we have until the end of September to complete the surveys, and then circle back in October, November on consolidating the responses and sharing with you and discussing what the results are. Over to R&J.
Nothing much to add, Asha. Just want to say thank you to everyone for attending this webinar today. The progress that we've made since we started this project has really only been possible because of the amazing engagement from you, all the participants. So just want to tell you how to continue to engage with us. Firstly, please sign up at the ghhbuzzboard.org. Here you can stay updated to what's going on new in the project, and also see the expansive online discussions that have really formed the foundation of our current thematic surveys. And as Asha just mentioned, to have your insights reflected in the ultimate outcome, please fill in a thematic prioritization survey. English has been out for a while, and French, Portuguese, and Spanish links will also be sent in the next couple of days. Aside from that, follow the Gender and Health Hub on Twitter. The Twitter handle is on your screen, and also sign up at the Hub website. That's it really. Once again, thank you so much for your participation, and we look forward to receiving your insights.
Thank you, everybody. I know we're over time and everyone's incredibly busy. We really look forward to your continued engagement and to bring you all back with the final results. Wishing everyone a good day, a good evening. It's late at night in Australia, Hong Kong, Japan, and those of you in the Americas are just starting. Let's stay in touch to keep the conversation going. And I'm delighted that we've made new connections and ways of staying in touch as this research agenda develops.